much.
There. Thanks, Caroline. 27 News Time is 6:37, and doctors and dentists are encouraging people to take some time to get screened for oral cancer, and they're making it really easy to do.
Joining us now is Dr. David Gunderson with First Choice Dental to talk about why this is so important. Thanks for being here. We appreciate it.
Thank you for your attention to this topic.
Yeah, so First Choice Dental does free oral screening cancers any time that anybody wants to do it. So why should someone take advantage of this?
Well, so whether it's First Choice or your home dentist, we don't care where you get screened, just get screened. 40,000 people a year are diagnosed with oral cancers. 8,000 people a year die from oral cancer. And the key to oral cancer is early diagnosis. If you get an early diagnosis, you have 80 to 90% success rates in treatment. If you get a late diagnosis, stage 3 or 4, where it's into your lymph nodes or it's spread to the rest of your body, your success rates for treatment are 20 to 30% at best.
And so it used to be that you thought people who were like smoking or tobacco users, males, were the ones getting oral cancer, but now there's a connection between people who have HPV and oral cancer. Can you explain this?
Yeah, absolutely. And I think what's important is, we always say, listen to your mouth. You know, if you have any unusual sores that last for more than a couple of weeks, if you notice anything unusual, get screened. Tobacco use, alcohol use, chewing, those are all kind of traditional causes of oral cancers. But the HPV virus, HPV-16, is now the most common growing cause of oral cancers. And it's not just older white males, it is 25 to 50-year-old women, men, all races, doesn't really matter.
Doesn't matter.
So it's something where if you have something unusual, get screened at any age.
And we've talked about how early detection is the key, so how do you guys screen for that?
That's great. So First Choice as a system has made a commitment to do oral cancer screenings at every single appointment. We have a great instrument called a Velscope that fluoresces, you can see kind of the light, it fluoresces tissue in your mouth, allows us to identify any unusual tissue, and then we can go back and do a visual screening and a tactile screening to make sure that there's no problem. If there is a problem, we then get you to an oral surgeon to make sure that you don't have an oral cancer. Most times you're fine. I don't want people to be terrified. If you have something unusual in your mouth, get it checked. Most times it's nothing, but you're better safe than sorry.
And this is really easy to do. It takes just a minute, a couple minutes or so.
We'll
actually do it.
Here we go.
Yeah, go ahead.
So what we'll do, so basically you open your mouth, it's non-invasive. I shine the blue light in, and as I look through, I can see tissue fluorescing or kind of glowing in your mouth if there's anything unusual. And fortunately, Danny looks great.
What about that spot, doctor? What about that?
Be nice, be nice, be nice. But so really that's the key. It is easy, it's non-invasive. Most times it's nothing, but get screened because early detection is the most important part of this.
And as you mentioned, most dentist offices or dental offices will do these oral cancer screenings for free.
We do them for free year-round, but this is not a plug for First Choice. This is an attempt to get you to get screened. Ask your dentist. They should be doing it. If they're not asked to be screened, if you want to come in to us, we do it year-round for free. You don't even have to be one of our patients, but get screened. And I think, you know, this is a chance for dentists and dental hygienists to actually potentially save a life. And so I think that, you know, one, I want to thank the hygienists that are out there doing this and the dentists that are doing this, and I want to encourage all of you to get screened.
Okay, definitely. Log on to the Wake Up page for more information about it. All right, thank you so much, Dr. Gunderson. We appreciate it. 27 News Time is 6:41. Your morning rush is coming up next.